Adult blacks are 20% more likely to report serious psychological distress than adult whites.
Hispanics and Latinos have a more positive attitude towards mental health treatment seeking than non-Hispanic whites, but they don't have the same treatment options as white Americans do.
Among Cherokee children with a mental health disorder, only 1 in 7 receive professional mental health treatment.
2 in 3 South Asians who suffer from mental illness will not seek help.
Here at UNC, you'll see a wide variety of students with different stories to tell. We've heard about our academics, our amazing sports teams, but unfortunately there's something that isn't very widely spoken about in our community, and that's mental health.
Mental health is a topic that isn't as openly discussed, despite how important it is, and the mental health of college students on our campus is even less discussed.
Before we begin our segment, it's important to define certain terms. For example, mental health. Mental health is a person's psychological and emotional well-being. Let's ask some UNC students of color what mental health means to them.
Mental health is an important part of your well-being.
Mental health is well-being of the mind.
Peace of mind.
We think that mental health is
being satisfied with who you are and accepting of yourself.
Another definition that we should be aware of is stigma. Stigma is defined as having a personal characteristic or trait that is viewed badly upon society.
Mental health stigma is a serious issue in our community. 3 in 4 people with mental illness have reported feeling some type of stigma.
Be an example of mental health stigma. An example of mental health stigma would be associating violent behavior with someone's mental illness.
Let's look at some examples of mental health stigma.
Hey Zara, how's it going?
I'm really depressed.
No, it has to be all in your head.
Did you hear? She has schizophrenia.
She is so crazy.
I know, I would never let her be around my siblings.
Me either. She's totally nuts.
Clearly, this is an issue that is going on in all of our communities. We need to speak up about the stigmas that students of color face.
Let's ask some member of these communities on what some common mental health misconceptions exist in their respective communities.
Okay, well, some stigmas about mental health illnesses in the Asian American community are that your problems aren't real and that what you're feeling is all in your head. So I know I've told my parents that I'm going to a therapist for my anxiety, and they always ask me, well, why are you wasting your time and money there? Like, there's nothing wrong with you. You're just stressed. You're not actually anxious. Like, you don't feel what you think you're feeling. And so a lot of it is just them disregarding my actual feelings and not believing me. And so a lot of stigmas around that in my culture is that it's just not believed and that these kinds of issues don't exist.
One big thing I know in the African American community, especially with my family, with regards to mental health and stuff, is that it's not taken seriously as like physical ailments and such. Like, I always tell my mom, like, whenever I have like anxiety attacks or if I have anxiety about certain things, and she's always like, oh, like, don't think about it, it's all in your head, like, it's not real, if you don't think about it too hard, it won't exist. Just things like that is a big aspect of what, like, the Black American community thinks about mental health and stuff like that.
So for Hispanics and Latinos in my community, I've noticed that they don't really focus on mental health. They really kind of push it under the rug. They don't think it's real. I've heard people in my community saying that depression and OCD and bipolar disorder are just like phases that you will get over, and that they're just not being taken seriously. For many Latino and Asian Americans, there may be a language barrier that prevents them from accessing proper mental health treatment. Once you factor in economic disparities, there's an even lesser chance of receiving proper medical treatment.
Numerous studies have suggested that being treated unfairly due to race on a daily basis has a negative impact on the physical and emotional well-being of African American students.
For Native Americans, there have not been enough studies to address the specific mental health issues of this group. This is not to say that Native American individuals did not face hurdles or personal challenges when it comes to mental health. This means that unfortunately, little research has been done to determine what mental health challenges these communities face.
Historical adversity, which includes slavery, sharecropping, and race-based exclusions from health, educational, social, and economic resources, is translated into socioeconomic disparities.
Socioeconomic disparities have a negative impact on the mental health of African American individuals.
I think it's important for students of color to know that their mental health is important.
Mental health challenges happen in our communities too, and they are nothing to be ashamed of.
You can receive the help that you need.
No one should have to struggle in silence. You are not alone.
We need to create a safe space for these people to talk about their various mental health challenges.
Experiencing mental health challenges or mental health illnesses is not a weakness.
It's also important for students to practice self-care and self-healing. Self-care includes any intentional actions you take to care for your physical, mental, and emotional health. Some examples of self-care and self-healing include getting a full night's sleep, going out to eat with your friends, exercising or meditating, or simply hanging out with your loved ones.
How can you tell if you or someone you know is facing challenges to their mental health?
What are some common signs that you or someone you know might want to consider seeking support? Eating or sleeping too much or too little, pulling away from people and usual activities, having low or no energy, feeling numb or like nothing matters, having unexplained aches and pains, feeling helpless or hopeless, smoking, drinking, or using drugs more than usual, feeling unusually confused, forgetful, on edge, angry, upset, worried, or scared, yelling or fighting with family and friends, experiencing severe mood swings that cause problems in relationships, having persistent thoughts and memories you can't get out of your head, hearing voices or believing things that are not true, thinking of harming yourself or others, and inability to perform daily tasks like getting to work or school, maintaining relationships, and completing schoolwork or tasks. Here are a list of resources on the UNC campus for mental health and wellness and Black student community groups. The Department of Psychology Community Clinic, the Sonia Haynes Stone Center for Black Culture and History, Carolina Women's Center, other campus health services such as women's health, primary care, sports medicine, and a pharmacy. Counseling and Psychological Services, also known as CAPS, LGBTQ Center.
Other resources include sexual violence and interpersonal violence prevention, which provides services for students who have experienced violence or harassment. It also has one-act training and other skill-building programs. Alcohol and Other Drugs Prevention and Interactive Services is a judgment-free service which focuses on reducing high-risk behaviors and working with students to prevent alcohol and drug abuse. Rethink Psychiatric Illness is a student-led organization committed to changing the way that the UNC community thinks and talks about mental illness. Safe at UNC provides resources for all students and staff about discrimination, harassment, sexual violence, interpersonal violence, and stalking. Campus organizations like the Black Student Movement, Carolina Hispanic Association, UNC American Indian Center, and the UNC Asian Students Association provide safe spaces for students of color to interact, meet, and network with students of similar cultural backgrounds. UNC Active Minds is dedicated towards challenging students to change the conversation about mental health on college campuses. Stigma Free Carolina is a UNC community campaign working towards ending mental health stigma on our campus. They provide resources, educate the community, and debunk common misconceptions about mental health. Some national resources include the National Suicide Prevention Lifeline, mentalhealth.gov, and the National Alliance for Mental Illness.